I'm a family physician practicing in Murfreesboro. Grew up in Murfreesboro, very familiar with Reef Sane, but did not begin using Medipack probably until about a year and a half ago when I came across, I had several patients who were having difficulties with their medication and actually had Reef Sane call me about a patient they were concerned about, may not have been taking their medications properly, and they suggested, because this patient had several medications, using the Medipack system. And I was not familiar with it, but they actually had a representative come out and show me the Medipack system, and I was pretty much sold as soon as I saw it. A lot of my patients will take supplements, especially patients who have osteoporosis. They also need to be on a particular amount of calcium and vitamin D, and I want to make sure they're getting those. And so I'll tell them, let's make this a part of your Medipack too, and that way you don't have to buy extra bottles. They're going to do this for you. Patients can just take their present bottles to Reef Sane. Reef Sane will package everything for them. When I talk to my patients about their medical problems and what I'm going to put them on, I try to make it as clear as possible when they leave what they're going to be taking and how often. But just because they leave with that information doesn't mean they get home with that information. And the Medipack system gives me assurance that what I told them when they left the office is exactly what they're going to be doing and getting when they get home. One of the things we frequently bring up is, I've got Mrs. So-and-so and she's having such a trouble with her medication. She's not taking it, she's non-compliant. And sometimes that non-compliant issue is not because the patient doesn't want to be compliant, but because maybe they're unclear about their medications or dosages. And I'll frequently say, have you thought about Medipack for that particular patient? Once you get over a couple of medications, that can be overwhelming for a patient to know what it's for and know when to take it, and that simplifies their drug regimen and makes them much more likely to take their medications the way they prescribe them. One patient I have in mind as we're sitting here talking is the patient with mild cognitive impairment, patient who is still independent, perhaps having a little bit of trouble because they have so many medications. And Medipack system can simplify their medication administration and possibly keeping them independent a lot longer. Patients who are taking lots of medications, particularly diabetics, who have underlying, of course, their diabetes, high blood pressure, high cholesterol, who might be on 2 or 3 different medications for each condition, and then perhaps on hormonal replacement therapy as well, and then suddenly they have 9 to 12 medications to keep up with, and that can be overwhelming. That simplifies that for them. It's right in front of them. They know what time of day to take it, what they're taking, and there's less likelihood to get confused and take the wrong medications at the wrong time.